We are looking at the final step with variable rate IV insulin, how to safely stop it as per JBDS guidelines. Many times you see patients started on variable rate IV insulin, they receive multiple infusions of insulin, substrate fluid, and despite their blood glucose coming in normal range and the patient starting to eat and drink, the variable rate IV insulin is not stopped. How should we stop variable rate IV insulin? This needs a bit of planning, and you need to look at 3 steps. If the target glucose has been achieved and maintained in normal range, and your patient has started to eat and drink normally, and lastly the usual diabetes medications can be taken, then your patient is ready to come off the variable rate IV insulin. All you have to do is to wait for a meal time to see that your patient is eating and drinking normally, and give them their usual rapid acting insulin before the meal or their oral medication, and wait 1 hour before you can stop variable rate IV insulin. Avoid stopping variable rate IV insulin at bedtime because you don't know how the glucose is going to behave overnight. Ideally, always wait for a meal time and give your patients their usual rapid-acting subcutaneous insulin just before the meal and stop the variable rate IV insulin 30 to 60 minutes after that. If you follow these steps, you can safely stop variable rate IV insulin in your patients. Congratulations! You are a safe prescriber of variable rate IV insulin. You have successfully completed the variable rate IV insulin flash video series. If you do find they are helpful and you're looking for other endocrine topics as per the endocrine guidelines, feel free to subscribe to the channel and look out for other endocrine topics in a similar format. Thank you for joining.